Okay. Right. So what we are discussing in today's session about the core processing system in Facets, because as we know, like Facets, at the same time, apart from that QNext, these are the two major applications. Of course, there are many other applications, but these are the two core health management applications, administration applications, widely used in IT healthcare environment, especially for claim processing, claim adjudication, all that. Because when there is a provider who has given the treatment for a particular patient, end of the day, they have to uh, develop the claim form, right? So based on the treatment what they have given, they need to mention all the details and they have to submit it. But when we are working for a business analyst role, especially in the field of business analysis, we should have a knowledge over the what steps normally we follow in Facets, because Facets is a healthcare application which doesn't have any trial versions or so. But what are the steps which are involved in Facets is what generally we need to learn so that it has more advantage for us being a healthcare BA. Right? That's what I'm explaining now. So Facets processing steps are as follows, right? So this is what we are discussing in our session today. Yeah. And so the process Facets processing steps I am explaining to you, Mukul, now. The first one, usually is called the claim, because normally before that what happens, I'll tell you. Whenever there is a treatment which was given to the particular customer or for a patient, medical coding people usually they have to do the claim related information and all everything they have to prepare. Once they have prepared all that, this will be loaded into the core Facets application. Right? That is the first thing which normally happen here. So this is what the first step, right? So in this, the first step is claims will be loaded into the core Facets, right? This is what generally the first thing usually happens whenever we are working on the claims application, right? So because when there is a treatment was given for a particular patient, there will be a case sheet. Case sheet means case sheet, like details about the patient, on which condition patient came admitted, what was the initial treatment was given, what was the procedure and the diagnosis they have made, and finally what kind of uh, pre and post training methods they have followed, right? So everything has to be updated on the form. So those forms will be loaded into the core Facets. This is the first one, which normally will be there in any of the Facets application. This is point number one. So the one which I am explaining you, this is what generally the first one is. After that, the next one is where we have to update and as well as edit the basic fields which are applied for the claim submissions, all that, right? So because basic fields and all everything we have to update. This is where generally we need to know about what are the different basic fields like the ID number, right? So all these things has to be updated equally. So, uh, yeah, yeah. So here, 1 minute. Right. So here, the basic fields which are required will be applied, right? So this is what generally the second thing which normally we do. So whenever there are any basic fields and all everything, there are different basic fields we have to update. Normally these basic fields are as follows. The first one is called subscriber ID. This is the first one, because subscriber, whoever has subscribed for a particular plan, right? Whatever they have and all everything. So that subscriber ID has to be updated in this. At the same time, membership suffix followed by the name of the member. Member name should also be mentioned, right? So these are the basic fields, whatever the subscriber name suffix followed by the member name, right? So all these things are comes under the basic fields which has to be updated in the form. At the same time, whatever the treatment and provider has given, so prior to that, there will be some diagnosis will be made, right? So for a particular patient, there will be some diagnosis will be made. So this is where generally we call it as diagnosis come into picture. So subscriber ID, membership suffix followed by the name. At the same time, whatever the diagnosis for a particular patient which was happened, right? So whatever is happened and all everything, so that thing will be updated in the diagnosis. This is what we call it as diagnosis transfer. Followed by the diagnosis, we need to mention the service provider details. This is also important because whoever is providing services, usually those service provider information has to be updated from where the services were taken by that particular individual, right? So which form, the claim form we are submitting. So we need to update the service provider details and all everything in this. Followed by this, we need to mention the total charges. Means what are the different charges which are applicable for what are the different charges which are applicable for claims related and all everything. So that's what we have to. So these charges may be procedure charges. It can be diagnosis charges. It can be uh, it can be even for drugs cost, right? So whatever the medicine cost, right? So all these things will be included in it. This is what we call it as total charges. Means total cost of the treatment which was given by us. This is all something comes under the total charges part. So the total cost of the treatment, right from the person whenever they have joined, from there onwards uh, till the discharge summary, right? So usually when there is a discharge happen, discharge summary report will be prepared. Till discharge summary, whatever the charges do we have for that application, for that particular claim. So those charges has to be updated here. At the same time, we need to mention the between dates from and to. From and to service dates. From and to service dates. Yeah, from and to service dates means when a patient has joined and when they have discharged. Between that, because how many days an individual is in hospitalization, was in hospitalization and all. That's what generally comes under this. This is what we call it as from and to service dates on that. At the same time, not only service dates, we need to mention about the place of service, in which place an individual has taken the services, the locality, the place of service, all that. Followed by this, we need to mention the procedure codes also, because these procedure codes, Mukul, depends on the treatment which was given. These procedure codes will be varied. It will not be the same for everyone, because you know that depends on the kind of diagnosis they have made. So followed by the diagnosis, whatever the treatment they have planned for a particular patient, based on that procedure will also vary, because it will not be the same, because high level procedure remains constant, but whatever the process of procedure they follow might be varying from one person to another person. So the procedure codes will be varied, because as you know already, there are different codes which are applicable for procedure as separate, for diagnosis as separate, even for claims will also be as separate. So that we have to mention about the
Right.
codes. Sorry.
So I mean that procedure code, right? Are we talking about here CPD? CPD is different, right? CPD code and
Yeah,
DX code.
yeah, I can write it. Procedure codes means I am talking about CPT codes.
Okay.
CPT
And
codes.
when we talk about DX code, that is diagnosis code, that is related to medicine and all, right?
That is there. But this is only here we mention the initial will be mentioned about the procedure code. That's what we mentioned in this
Okay.
form. First of all, initially to start with. Understood, Mukul? Clear?
Yes.
Right. So once the procedure code was mentioned, even we have to give the revenue code also. The revenue code will also be mentioned, because on what basis revenue related code numbers we use, as like as the procedure and diagnosis. Generally, this revenue codes will also be used here. At the same time, whatever the code numbers which are applicable, if any, right? So code numbers which are applicable relating to Facets type of service codes, because not only the procedure, if there is any kind of service code numbers or etc., those service code numbers will be taken upon, right? So claim processing will be done initially. Once the claim processing will be done initially. Once the claim processing is done, the next, so basic fields relating to the whatever are the basic fields which are applicable and all, everything will be updated in the second one. Is it clear to you,
Yes.
right?
Yeah. Clear.
Right. So this is the second one. This is what generally the first one claim will be loaded, and what are the basic fields we want to update and all, everything will be done over here. So after that, the third one, which is normally we call it as eligibility check. Right. So eligibility check is what generally eligibility check in terms of the member, that particular member and all. So that eligibility check has to be seen, because this in this eligibility check we need to see the valid class which that particular member belongs to, At the same time, what kind of plan? Because these plans can be of anything. It can be Medicare plan, it can be Medicaid. Again, in Medicare, they may come under A, they may come under B, C, and D, sometimes A and B. Because A and B are both relating to inpatient and outpatient services. So that also will be mentioned over here, right? So valid classes and all that. At the same time, valid class or a plan has to be mentioned. At the same time, we have to mention about the member eligibility. So member eligibility should also be mentioned here, right? So what particular eligibility a member is having, so their details should also be mentioned over here. This is what we call it as member eligibility stands for. So because this member eligibility, whatever are we talking about, it has to be verified and validated. That is essentially required whenever we are working on, right? So validation is needed because whether is that person has valid, because normally what happened, this is not something by intention. Maybe sometimes there are some human errors might be taken place. I don't say that which is not happens, but there are possibilities that might be some overlooking kind of stuff might be taken place. Hence, validation, verify and validation is essentially required. So this is what generally we need to do in reference to that. This is what generally we call it as eligibility check stands for. So once we have identified the eligibility, we need to validate, verify and validate the provider status also, because whoever is providing the treatment, hospitals or healthcare clinics, those details should also be mentioned over here. Yeah, next one is this, right? So this is what generally we do. So once it is done, we need to validate provider status. We need to validate the provider status. The provider status means under which network they belongs to. Under which network they belongs to, right? So because normally East and West, these are the two basic networks to be have and all. So being whenever we are working on this claim processing kind of all that, so we have to verify and validate the provider status even, right? So apart from the eligibility checks, all that, so we have to verify and validate the provider details, all that. So this is also one of the key element which we have to be focused more, right? So verify and validate the provider status is also needed. Yeah. So yeah, validate provider status will be done here. So once we have verified the provider status, means hospital or healthcare clinics and all that, wherein we need to mention over the kind of information which is relating to the service definition point of view. Like we need to determine the service definition, like assigning service definitions, right? So all that stuff normally. So this is where we need to determine the service definition, which normally we have to do it. Service definition has to be determined here because this is something majorly used to majorly like this kind of service definitions and all everything majorly used to determine the price of it. Price, determine the price and all everything. So this is where generally it will be off.
Yeah, is that related to services given to patient that we're
Yes,
talking about here?
yes. Service relating to the patient, the cost of that, because end of the day, this is will be used for the claim processing, right? Reimbursement is what we are observing. So this is relating to the patient I'm talking about. Understand, right? Understood or not?
Yes, yes.
Are you clear?
Yes, I'm clear.
Yeah, good. Yeah, right. So we need to determine the service definition in reference to the price what they have mentioned, right? So those details has to be updated subsequently over here. So whenever we are talking about the service prices and all, so this is majorly based on the kind of agreement what providers will have, because normally providers will have an agreement with the payer companies, right? So because normally I'll tell you the context. When someone has taken an insurance plan, of course, what will be the reimbursed amount? Sorry, what will be the claim amount and all everything that will be there, right? So that what is the amount they are eligible for will be there. At the same time, whatever the procedure, whatever the cost for diagnosis and for treatment and all, the cost will also be there, right? For example, if there is an X-ray is what is taken, this is what generally are we going to pay, right? So this is because this is depends on the kind of plan what people have taken. So when an organization means as a provider, I'm saying this, when a provider has an agreement with a particular payer, right, from the insurance company and all everything, the prices ranges and all everything will be different if they are in the particular network. But you cannot say that the same thing for all the what I can say for all the providers now, because some situations where provider is not in the network of the insurance payer sometimes, right? So there are cases which will happen. So if that was the case, whatever the what we call whatever the cost of prices and all everything will be different from context to context. Is it clear? Understood or not? Right, Mukul. Right. So
Yes,
this
yes,
is one more context. So after that, we need to validate and check the duplications, um, duplicate logins, I could say. Login if any. Because if there is any duplicate login, we have identified something of that sort. If there is any kind of duplicate logins, do we have all that in this present existing one? If we have any duplicate logins or something, generally this duplicate logins and all everything will also be checked it, because sometimes it's not by intention, maybe due to missing kind of, maybe sometimes double entries will be taken place. If there is any double entry, automatically this process will happen twice. So before you are sending this to the payer, it is always important for us to cross check through claim scrubber. This is where generally the context of claim scrubber come into picture. In this claim scrubber, we have to see whether uh, the claim is valid or not, to what extent, if yes, to what extent. At the same time, we have to see if there is any kind of duplications do we have and all everything. So that also we have to see. This is where generally checking the duplicate login, if any, or something, which will be included in it. So this is what something which is important. This is what something which we have to be focused more of, right? So this is also one of the key element we have to see when we are working on all these things. So
second
whenever we
topic
are
is
checking
we are
the
talking about.
Yes, tell me.
Sir, yeah, duplicate logins mean we are talking about duplicate entries, right? If there are any entries.
Duplicate multiple entries for the same claim. If there is any multiple entries were there, that has to be checked and that has to be removed.
Okay.
Understood?
So,
Mukul?
if yeah, I mean, when I worked as an AR, I remember that we would get claim rejection because of duplicate 18. So, is that the reason?
Yes. Yes. Because it normally if we don't do it sometime if we don't do it sometime in the claim scrubber, because before we are sending to the payer only, we have to check all that. In the claim scrubber, we have to check. If there is any rejection on these grounds happens means it could happen. That there is a possibility. Due to the duplication logins also, there will be a rejection taken place. That will also be there. That's the reason why claim scrubber is important. Whenever there is a login process of that particular application we are updating, so there must be a login process which we have to see. At the same time, we have to see the claim scrubber, right? Through claim scrubber, we have to see whether is there any duplication of entries was done for that particular thing or not. That we have to see. That's what we call it as checking the duplicate logins, if any, or something of that sort. Is it clear?
Yeah.
Understood or not? Right?
Right.
Right. So this is what generally we need to see in reference to the duplicate edits. Check all that. After that, we need to yes. After that, we need to So after that, we need to manage the care services, because care management and case management will be there. Because what kind of care management services will be taken for a particular patient, even after post treatment, I'm talking about, right? So if there is any kind of managed care services, if any, uh, managed care, right? So managed care services. At the same time, if there is any authorization edits or something, right? So authorization edits or any managed care services and all everything, that also will be included in this. So this will be done once the duplication of checking and all everything we do. So this is what we have to see, because there is two concepts, Mukul. One is care management and second is case management. Care management means after care, means post treatment, whatever the care we have taken for a particular patient and what steps and what quality of care we have taken. Is there any kind of necessary arrangement of care or the services we have planned for a particular patient? Because there will be some therapy kind of things which we have to do at home, right? Because that services might also be there sometimes. Sometimes that services will also be there. Hence, we have to make sure that whether is there any managed care or is there any edits and all everything why do we do it? That is a different thing. But managed care means what kind of care services are we providing for the particular case? Because this will be varying from case to case, Mukul, not the same. This can be varied, it depends on the case to case and all everything. This will be varied. That is one thing which normally happen here. Followed by managed cares, all that. The next one will be going for editing part, right? So because we have to see whatever the clinical editings we are doing and all that, at the same time we have to make sure the claim processing will happen properly, right? So this is where generally we will be doing, I can say, clinical editings, right? So clinical edits will be taken place. At the same time, whatever the claims we have seen and all that, so we need to update the claims check login here, right? So clinical edit means is there any editing in reference to the clinical process what hospitals means provider has followed, if there is any kind of edits, maybe any grammatical mistakes or so, right? So that we have to cross check. That is essentially required. At the same time, initially to start with, whenever there is a claim processing, so we do whatever the claim login process we usually follow. The claim check and login process is what we have to be updated over here. So this is also happens. So it's not only about managed care and as well as authorization edits, but it is subsequently it is important for us to update the clinical edits followed by the claims check logins, etc. All that. So once the clinical edits and as well as claim check login was done by us in the Facets application, next we have to update the service pricing part. So normally here we need to see the appropriate cost of services, because in the beginning, if you remember, I mentioned a point. Depends on the type of plan which that particular person belongs to, whatever the services are they eligible for, followed by the cost of that particular services will also be varied. It will not be the same all the time, right? So if, for example, the best part I can say is that we have like basic plans and premium plans, you know it, right? So for example, a person has taken a basic plan. That basic plan person is authorized and eligible to meet any doctor uh, based on the plan and all, right? So they don't have any other provisions to meet any doctor kind of. But someone has taken uh, uh, premium plans, right? So premium plans and all that, that individual has a facility where they can meet the doctors whoever they want, right? So there are two kind of, one is basic plans and second is premium plans, you know that, right? So that will be there. So depends on that, whatever the services that particular policy uh, belongs to. At the same time, whatever the prices and all everything will also be varied. So once the clinic edits and claims check login is done, we need to mention about the service pricing. Service pricing is also needed here, wherein we need to determine the appropriate price for the submitted services what we have mentioned on the claim that is required. So this is where we talk about service pricing. This service pricing can be included of anything, right? So whatever the services taken, either it can be diagnosis, it can be medication, right? So it can be procedure, right? So whatever it is, right? So whatever the services a provider has given for a particular patient. So it depends on the kind of plan that particular patient is holding or the customer is holding. So that will be varied, it depends on that. So that is the one thing which we have to be very clear, and that is one thing which we have to be known with, right? So that is also required. So this is where generally the
But
service
we have
pricing.
already given, sorry to interrupt you, but we have already given that total charges at the first beginning, at the level of that, I mean,
What,
here.
yeah, total charges was given in the first one, wherein whenever there is a claim check process login has happened, then now we were clarifying the service prices once again. That was the point. So there we have mentioned the total charges, Mukul, not the cost of the service pricing as separate. Because total charges is what I was mentioning. For example, for the total cost of the treatment was somewhere around $1,200. Let me put you this way. $1,200 is the total charge. But in this $1,200, can you expect that customer will pay you $1,200, payer will pay you $1,200 for that particular claim? May or may not. On what grounds? Because the $1,200, including the procedure, including the diagnosis, including the medication, etc. Am I right? Right?
Right.
Yes or no?
Yes.
Okay. So when there is a diagnosis or a procedure or a medicine, of course, forget about medicine. for a diagnosis and as well as procedure and all, depends on the eligibility of the insurance plan and all, whatever the cost which was accepted between the both the parties will varies. Do you agree on that? Yes, sir.
Right.
Right. So here we have mentioned the total charges, not the line of services relating to the services what they played, not the individual ones. It was not mentioned the individual charges over here. Means how much happened for the procedure, how much happened for diagnosis, how much happened for medicines or